Hi everyone, I'm Dr. Jennifer Lades with Mulling Mortician, and today we're going to talk about safe handling and care when we're manipulating decedents. Now oftentimes this is going to be important in examples such as when you're receiving a loved one initially, performing a transfer, also when you're bathing or dressing a decedent, and then when you're performing surveillance after embalming. You're going to want to monitor their condition, including their backside, for any issues that may arise or trauma that you're addressing. Now, prior to beginning this task, you're going to want to make sure you have your proper protective personal equipment or PPE. I would don gloves, an apron of some sort, and arm coverings. Your employer should be providing these items to you. And if you're working with someone else and they choose not to wear gloves, don't sweat it, worry about you, because safety is always first. Ideally, in this situation, you want to have 2 people. And even if it is a smaller person or not someone who's extremely heavy, that's going to allow for communication while one is holding. You can observe in the back. And also, it's going to help just to keep you a bit safer, especially if you're in a situation where they are a smidge heavier. You're going to want to utilize a table, if possible, that has height adjustment. It's going to be important for ergonomics and back safety that you don't overextend. And again, you're going to be working with a second person, and you want to make sure that whomever is performing the physical rolling has that table at such a height they are not overextending themselves. So prior to checking this decedent, I have confirmed their identification. Okay, I have donned my PPE, and I have removed any jewelry that might be a hindrance, such as dangling necklaces, bracelets. I typically don't like to wear rings within my gloves because of powder and things of that nature, but I've made sure that I am properly ready. And then I asked for my second person to come on in and give me a hand. This is Caitlin Gillespie, and she's my volunteer for today.
Hi everyone.
All right, so prior to doing this, any supplies or items needed have been set aside. So for example, cleaning solutions, any types of towels or cloths. If we're addressing a cavity pack or trauma to the back, I may have those items nearby. Again, we're going to make sure the table is at the right height. I'm going to show you where to place your hands. This is especially important. So with the decedent, you want to make sure that you're putting your hands in such a way that you're able to really capture the majority of the weight for yourself as well as for them to make the task easier. Now in this case, I want to make sure that I am grabbing the upper arm here between the elbow and shoulder. You want to avoid pulling like this. And the reason for that is you can compromise skin and cause damage. Okay? So your first hand will be here, and your second arm is going to be here near the hip or buttock area. I'm a bit overextended right now, and in an ideal situation, I may have the table changed a bit, and also you can move the loved one closer to you, okay? You want to make sure you communicate with your second person, and we're going to be looking for signs of fluid distribution in the form of color, firmness, and texture, as well as any issues that may be arising over time. So I'm going to go ahead and roll him on 3. Ready? 1, 2, 3.
So as she was saying, I'm checking to make sure there's no leaks, anything down here, and of course, make sure that he's clean on his backside, and so far so good.
All right, I will gently replace him back. Now keep in mind too that you can make this task easier initially by utilizing such things as body positioning blocks, forming a bridge of sorts underneath. And that will allow you not only to form space between the tissue and the surface, but also if you are inserting straps to utilize with a lifting device. Okay? Now keep in mind if it is a heavier person, it is not a bad thing to use a lift if you have one at your location. You want to make sure you work smarter and not harder. So I hope you found this helpful, and I'll see you all out in the field.